of modalities within the physiotherapy unit that can help us manage pain as far as pain management is concerned. But you can think of transcutaneous electrical nerve stimulation. You can also think of cold therapy, heat therapy, and even some other diathermies like microwave and shortwave, depending on the condition the patient has presented with. But the most challenge regarding electrical stimulation is pad placement. Sometimes a lot of therapists have challenge when it comes to pad placement, because remember that if you do wrong placement of the pad, you are not going to achieve the intended purpose. You are not going to achieve anything. And so it means that constant education about pad placement is very crucial for most physiotherapists. And so in this video, I'm going to be talking about how you can do pad placement for someone who has presented with an elbow pain. Before I come to that, I would like you to subscribe to this particular channel and also leave your comments in the comment section about the video, and don't also forget to smash the notification bell. If you do that, it means you are going to be notified anytime a video is uploaded. Alright, so please do not also forget to give us a thumbs up when you consider this video helpful. Give us a thumbs up. Don't also forget to give us your comments using the comment section. So now let's begin. As I said earlier, I'm going to be teaching you how you can do pad placements for an elbow pain. Okay, so before we start the whole thing, you have to know about the transcutaneous electrical nerve stimulation machine. This is a portable machine device like this one, and it has connecting wires. You see, the wires are just coming with a unique color. So we have the edge that is connected to the machine. We have one being reddish and the other one being black, so it applies to the other one as well. But let me remind you that the colors are not just there for fun. This one, the red color, is called active electrode. You see, it is an active electrode, and this one is the inactive. So we have a way of connecting these things. So why I would always prefer using electrical stimulation, that is the TENS particularly, is because TENS is able to provide symptomatic relief of pain, and then it also, chronic and acute pains, and it can also be helpful for post-traumatic and post-surgical pains. You see, so the patient coming with an elbow pain, I can still use TENS for the pain relief. You see, yes. So like I said earlier, this is the active and this is the inactive, and so I have to expose the area to be treated. So supposing this is the elbow I'm going to treat. Now the electrodes, that's the pads, they can stick to the skin. Immediately you apply it on the skin, and so you have to make sure you clean the area to be treated, or the area where you are going to apply the electrodes pads with alcohol. So I wouldn't prefer placing the electrodes here, but I would rather prefer the back parts. So I have to wipe the area. I'll wipe the area nicely, and then the patients might probably be having the pains around this area. So it means that is where I have to center my active electrode, you see. So I'll just place the pad there. This way, I'll let it face the other one. Place this one also here.
Okay. Yes. So now you see. So remember I said the active electrode is always placed on where the pin is centered. Okay. Yes. When you are done, I'm supposed to say this. This is the active electrode and the inactive. Now you can either use all the 4 parts. That is when maybe the patient has the whole joint inflamed and there is pain everywhere. So in that case, you can also place one of the electrodes on top and the other one there, here and there, so that you'll be facing the other ones underneath. You understand? Yes, but in that case, we are going to use only these 2. So when I'm done, I will then have to connect my electrode to the channel 1. So let me remind you that I have a video that gives a wide description about TENS on this particular channel, so you can find that out and know more about the TENS unit. Okay, yes, so I've put my battery there. This is battery operated. Then I switch it on. I make sure I set to high frequency, low intensity, so that I can get paraesthesia effect rather than getting muscle contraction. Okay, so I'll set. Okay, that one is being described in the first video, so you can just go there and watch. So I will search everything and put them on the screen, and then I begin to increase the intensity. So basically this is how it is going to be. I'll make sure you have the patient relax the elbow somewhere. Okay, then you start your therapy. You can use 15 minutes. 15 minutes will be better for the patient to get relief. Yes, so I'm feeling it. Okay. Wow. So I'll leave it for the 15 minutes to get exhausted, you see. And after which, I am expecting the patient to give me positive feedback that there is pain relieved. Because one thing about TENS machine is that it is able to give immediate pain relieving effects, you see. So when you use that, it is helpful for the patient than rather using other heating modalities or cold modalities. Don't mind, my battery is just disturbing. It's kind of down, so that is why you are hearing that noise. But when you are using your own, it is not going to be like that. So basically this is how you do the pad placement for an elbow pain. I will come back with more, introducing you to how you can do pad placement in some other pain sites. You see, if it is shoulder pain, how are you going to do it? If it is a wrist pain, how are you going to do it? If it is neck pain, how are you going to do it? What if it is low back pain, how are you going to do it? I'll come back with more. So thank you so much for watching this episode. Make sure you become part of this channel by subscribing to the channel, and make sure you also give us a thumbs up. So bye, my name is Thomas.